LimFlow is a company focused on treating end-stage patients with peripheral artery disease of the leg who are at risk of losing their legs to amputation. You know, we're working with patients who really are going to lose their limb. So they've passed all the current options for therapy, and they're really just either scheduled for amputation or waiting for amputation, waiting for an infection to set in that would cause the doctor to say, okay, now we amputate. So peripheral artery disease has really come to the fore as a major focus for medical device companies and for medicine at large, because we've been very successful at treating coronary artery disease. So when LimFlow comes along and says, well, we actually have a solution that can provide a very real difference for these patients who are the sickest of the sick, of course they get excited, because they know this patient population is growing. They know the needs are not going to go away. In fact, they're increasing. We know the underlying disease states that cause lower limb disease, which is diabetes and cardiovascular disease, are rising. We hear that all the time in the news about the epidemic of diabetes. And that's the leading cause of having a wound on your foot. So we know it's getting worse and worse, and we know the tools aren't there. So when we can come along and offer a completely new tool for the sickest patients that we have, I think naturally everybody's excited. And no physician wants to tell a patient, I can't do anything more for you. And frankly, the healthcare system doesn't want to pay for the expense of amputation and everything that follows it. And of course, the patient doesn't want to contemplate losing their limb, losing their mobility, because most of these patients will never walk again once they have an amputation. And that's because they're not young anymore. And so recovering from a major limb amputation isn't like when you're a soldier who has trauma in Afghanistan and comes back and has an amputation, and then he runs the Boston Marathon next year because he's strong and fit and can recover. You're talking about a 75-year-old person with obesity and diabetes and end-stage cardiovascular disease, potentially on dialysis. They're not going to be able to go through rehab and recover in the way that a younger person would. And that's why when you lose that limb, in some ways you lose your life. And that's what we're trying to avoid. We want to take a no-option patient population that's out there with end-stage critical ischemia who are going to lose their limbs, and we want to be the option for them. And so we feel profoundly privileged to be keeping these patients from amputation, because it does mean they have a very high risk of dying in the next year once you have an amputation. So we feel like any step we can take to take these no-option patients and give them an option is something that, it's not so often in your how would you say, career or in your work life that you're able to have such a profound effect on each individual person.